So good afternoon, everyone, and welcome to the inaugural Policy Impact Project Policy Power Lunch. And before I bring on our esteemed speaker, I just want to briefly acquaint you all with the Policy Impact Project and go over a few housekeeping items with you. So if you want to ask any questions of our speaker or about the Policy Impact Project, feel free to use the Q&A box. There's an icon in the slide below for your reference. The Q&A will be facilitated at the end of the presentation. We'll allow about 15 minutes or so for folks to put questions in the Q&A, and then one of our Policy Impact Project staff will be moderating that. If you're having any tech issues or challenges or anything you want to put in the chat, feel free to use the chat box, and you can see the icon below. If you need closed captioning, please use the CC closed captioning icon on your Zoom toolbar. And with our speaker's consent, we are recording our presentation this afternoon, and we will be posting it on our website in the coming weeks. At the end of our presentation, there's going to be a pop-up with a link to a survey. It'll take just a moment of your time, and it'll really help us in letting us know how we're doing and how we can improve future events and topics that we can feature in future events. So this is our first kickoff event as the Policy Impact Project. So I want to introduce briefly our team. We have myself, I'm Caitlin Copper-Miller, representing the Policy Analytics Center at the A.J. Drexel Autism Institute. Anne Rue is my co-director of the Policy Impact Project, and Kyle Shavasta is our project coordinator. So the Policy Impact Project is a joint venture of the Policy and Analytics Center and the Life Course Outcomes Research Program here at the Autism Institute that's directed under Dr. Lindsay Shea. And our mission is to flip the paradigm of policy to research translation. The Policy Impact Project will use our research findings to propel systems-level policy solutions with a focus on individuals on the autism spectrum and with other developmental disabilities. And the reason that we started the Policy Impact Project is because there's such a large disconnect between research and policy. And there's a need to translate research for policymakers, for families, for individuals on the spectrum, so they can really be a part of the research discourse. And why autism is because there are specific policy challenges and changes needed for autism specifically, as well as the broader policy context to address the needs most effectively of autistic individuals in their families. So what we are doing is we will be engaging with key stakeholders and partners, conducting our own research that impacts policy today, highlighting research findings of our colleagues in a way that translates to policymakers and folks in the community, as well as collaborating with other researchers to prioritize research questions that have a direct translation to policy, and also providing researchers with the tools and resources that they need to create translational research products as well. And I encourage everyone to follow us on Twitter. Kyle Shavasta has been a great voice of our Twitter to engage with the research discourse and to put out very translatable findings. And so please, at impact_policy, you can join us in the conversation. And we are also just launching our website, which can be visited at policyimpactproject.org, where we will have resources, blog, information about various policy areas from the criminal justice system to COVID-19. So it's just now launching, but please stay in touch with us and keep an eye on what's going to be coming down the pike. Without further ado, I want to welcome up Rachel Gaddes, who's going to be leading our session today, focused on policy practice and the Autism CARES evaluation. Take it away, Rachel.
Great, thanks, Caitlin. I'm just going to share my screen and pull up. Let me pull up my screen share here, make sure everyone can see that. All right. I'm assuming people can see my slides. So hi, everyone. Thank you so much for taking the time to join us today. And a big thank you to the team at the Policy Impact Project for bringing us all together. Like Caitlin said, my name is Rachel Gaddes, and I am a Senior Study Director at Insight Policy Research. And I've been involved in designing and implementing policy research and evaluation studies for the federal government for the past 15 years or so. And in this role, I have worked with a range of federal agencies, including the Department of Health and Human Services, the Department of Agriculture, and the Department of Defense, and several others. So I'm really excited to be here with you all today and share my thoughts and reflections on a topic that I'm personally very passionate about, which is applied policy research. I know that makes me a big nerd, but I have a feeling there are some fellow nerds in the audience as well. So here you can see our agenda for today. I'll give a brief introduction of policy research. We'll spend a few minutes talking about the Autism CARES Act. Then I'll tell you how we evaluated this policy, including a discussion of our evaluation goals and methods and some of the considerations and challenges that we faced, as well as the implications of this research. And like Caitlin mentioned, we'll wrap up with a Q&A at the end. Before we get started, I wanted to tell you a little bit about Insight Policy Research. So we are a woman-owned small business. We were founded over 20 years ago. And the mission at Insight is to conduct research related to at-risk and vulnerable populations. So we mainly work with federal government agencies and states to support their research needs. And we offer a range of data collection, evaluation, statistical, and technical assistance services. So the work that I'll be talking about today falls within our health practice area, but as you can see in the slides, we also do work related to family support, food and nutrition, education, workforce development, and military and veteran support services. We currently have about 90 employees, most of whom are located in the Washington, D.C. area, although we do have staff in other parts of the country. I personally live in tropical Portland, Maine. And during the Q&A or any sort of follow-up afterward, I'm happy to tell you more about the work that we do at Insight. To get us started, I wanted to walk through an overview of the policy research lifecycle. So this graphic shows the typical steps in the process, and it can be used as a framework to really highlight the ongoing nature of policy research. So at the top, you can see that the process starts with some sort of policy challenge or issue or priority. This can be a research question that the government has, or it can be a policy that's under consideration and there might be interest for a third party like us to assess the potential impact of the policy. So next comes the funding for the policy research study. And as I'm sure you can imagine, that can range a lot, and the amount of funding ultimately comes into play when we're designing this study. And the process that typically happens is that a firm like Insight Policy Research would prepare proposals in response to the government's request, and our proposal gets evaluated against our competitors, and the government awards a research contract to one of the groups to take the lead on this research. So next comes the actual research itself, which is designing the study, collecting primary data, or analyzing existing data and reporting on the results. And as I'll talk about in a few minutes, the way that we report on policy research findings is quite different than what you might be used to in academia or in other sectors. Once the results are disseminated to decision makers, these leaders then have the opportunity to develop legislation that is informed by the evidence. So this might look like funding and support for new programs or changes or expansion to existing programs. And then once these new programs and policy get underway, more research can evaluate the effectiveness of the legislation, and then the cycle starts over again. So if there's one thing you take away from this graphic, it's that policy research, even if it's happening behind the scenes and it might not be something you've ever thought of, it really does inform the policies that impact your life, both as professionals and as citizens just living in your community and in this country. So let's now look at a real life example of this policy research life cycle, which is the Autism CARES Act. In this case, the policy challenge that the government was facing was understanding autism spectrum disorder and improving services for children and adults with ASD. The funding for this research was awarded to us at Insight Policy Research via that competitive process that I just mentioned. And we designed and conducted a study to answer the government's research questions. We developed and implemented an evaluation of specifically the Maternal and Child Health Bureau's efforts surrounding the Autism CARES Act. And the results of that evaluation, which showed the impact that the program had, influenced the reauthorization of the act, and over time led to certain adjustments to the program and creation of new grant programs. And this life cycle is ongoing as different evaluations are still underway to look at these efforts. Let's dig into this example a little bit more. Some of you might be familiar with this, but just a brief primer about the Autism CARES Act. So CARES in this case stands for the Autism Collaboration, Accountability, Research, Education, and Support Act. And it was originally enacted in 2006 under the name of the Combating Autism Act, and the name has changed over time. This act authorizes almost $370 million in federal funding each year. And the most recent iteration of the act has a new focus on looking at autism throughout the entire lifespan and not just focusing on children. So that's one of the new focus areas of the more recent versions of the legislation. Those hundreds of millions of dollars of annual funding are funneled through 21 different federal departments and agencies that you can see up on the screen here. So these range from the Department of Health and Human Services to the Department of Defense, the Department of Justice, and even the EPA is receiving some of this funding. And all of these agencies are working to support programs related to autism funded through the Autism CARES Act. So as you can imagine, this is a really huge effort. Looking at all of these agencies, what we actually focused on with our evaluation was evaluating HRSA's activities under the Autism CARES Act. And if you're not familiar, HRSA is an agency within the Department of Health and Human Services, the Health Resources and Services Administration. And within that, this is implemented through the Maternal and Child Health Bureau. So lots of federal agencies, lots of hands are involved in this. Looking at this big picture, we were focused on evaluating this smaller piece within the larger act. Specifically, HRSA, in the current fiscal year, they are working with about $53 million in funding. And these funds support 4 different grant programs and approximately 90 grantees. Those grantees fall under 4 programs, 2 of them that focus on training pediatricians and other providers, 1 program that focuses on research, and 1 that focuses on funding states to improve their systems of care. So the takeaway here is that even though our evaluation, as you'll see, was large and complex, in the grand scheme of things, it only really addressed a small portion of the Autism CARES Act activities that were being executed across the entire federal government. Our evaluation had 5 main research questions, and each one linked back to one of HRSA's objectives in implementing this act. Our questions aim to assess how the grantees were contributing to the training of professionals and service providers, how they were increasing awareness and disseminating information about autism, how the grantees were contributing to research, how they were working to reduce barriers of care, and how the grantees supported youth transitioning to adulthood. Now, although we were tasked with answering these 5 research questions, as the evaluators, we had to consider a number of other factors when we were designing our evaluation. First, as you can imagine, we had to consider our budget. And this influenced how many staff and what type of training and expertise our staff could bring to the table and how many people could actually work on this study. We also had to consider the government timeline. So in this case, we had several years to conduct the evaluation, but on other studies, we need to design our research to be completed by certain timelines that might be designated by Congress or other clients. And those might be really fast, like turn this whole thing around in 6 months, or we might have 5 years. So the timeline is a factor. We also had to consider what data existed to help us answer these research questions and what opportunities existed for us to collect new data within the confines of the budget and the timeline. And finally, we had to consider the needs of the decision makers. So who would be consuming these results and what would they be doing with the information? I'm just seeing a question coming in here about whether our work included autistic self-advocates. If so, to what extent? So that's a great question. I will cover that briefly when we start sharing the findings. Thank you. So one of the challenges in designing and conducting an evaluation like this is how do we take all of these considerations and come up with a way to answer these research questions? So on the screen here, you can see the different data sources that we drew from. These included reports that the grantees were submitting on a regular basis, primary data that we collected via a survey and interviews with grantees, numeric data that the grantees submitted on their performance, and also results of literature reviews and environmental scan of national and local policies. So one of the challenges that we face when we design and conduct an evaluation like this is that the program is actually underway and being implemented in the real world amid lots of changing circumstances and political priorities. So we faced several challenges and limitations that I've outlined some of them on the screen here. One challenge we faced was that the performance measures that the grantees were required to report on, they actually got updated and changed midway through our evaluation period. So that was through a larger effort at HRSA as an agency. And what this meant for us is that we didn't have consistent longitudinal data to look at performance over the evaluation period. Another challenge is that we were evaluating over 90 grantees and their funding periods were each on their own schedules. And that didn't align with our evaluation timeline. So on the next slide, I have a graphic that explains kind of what I'm talking about with that. We also faced the challenge of evaluating these programs as a whole, but some of the individual grantees had been working in this area for a long time and others had just received their funding. And that made it really difficult to compare grantee experiences against each other when they were not really on an equal playing field in terms of how much experience they all brought to the table. Our primary data collection activities were also quite limited, and although we did interview all 90 grantees, there was no way in a 60 or 90-minute interview that we could really hear about everything that they were working on. And finally, one of our biggest challenges is that many of the grantees leveraged other outside funds alongside the Autism CARES funding, which made it really difficult for us to definitively say, this is the impact of this funding, because all the different grantees used the funds in combination with other financial resources. As I mentioned, this is an example of one of the challenges that we faced in our evaluation. I realize this is a complicated slide, so I'll walk you through it. So across the top, you can see the years 2011 through 2021. And each blue and gray block represents a different one of those grant programs. Each of these grant programs funded anywhere from 5 to even over 40 grantees. So a grantee might be an institution like Drexel, or it might be a university, or it might be a state. You can see here that some of the grants were funded for 5 years, some were funded for 1 year, and the start and end date of their funding period, some of them aligned with the calendar year, some with the fiscal year, some with the academic year. And our job as the evaluator, and what was written into our contract, was to evaluate the time period of 2014 to 2017, which is that red square in the background. So as you can see, it did not line up perfectly, and we had to consider how far into their funding period different grantees were as we were conducting our evaluation activities. So this is just a real life example of what it's like to conduct policy research in the messy real world. And now one of the things we're facing as evaluators is, how are we going to deal with COVID? There's going to be major blips in our data. How are we going to talk about it in our reports? It's something that we're discussing on an ongoing basis right now. So speaking of our results, I wanted to share some of our findings of our evaluation. Now, rather than trying to summarize all of our findings, what I tried to do here is pull out different types of findings to highlight the types of information that can result from an evaluation like this. So these are some illustrative examples, and I have some links to where you can find the full reports and all of our research products that are made public and made available on the HRSA website. As I mentioned earlier, when we're designing an evaluation like this, we consider the needs of the decision makers who will be using these findings. When I say decision maker, this can include a range of different types of people. So it might include agency leadership. So in our case, it was the leadership at HRSA and at the Maternal and Child Health Bureau. These are the individuals that are tasked with administering the funds that were allocated to their agency. Decision makers might also be Congress or lawmakers at the state and federal level. And we also knew upfront in the case of this study that our findings and our research products would also be used and made public and would be consumed by grantees, clinicians, advocacy groups, and others working in this space. So we really had to take all of that into consideration when designing our evaluation and when thinking about how to disseminate our findings. So when we considered how to present our findings, we knew that these decision makers would want to know, is this program working? What impact was the funding having? And what should happen to this program in the future? So with that in mind, some of you who might be in academia might be used to presenting results in a different way. In our case, our findings focus more on plain language, infographics, making actionable recommendations where appropriate, and less on detailed methodology descriptions and technical jargon. That's not to say that our methods were not rigorous. They were rigorous and robust, but the decision makers, we don't often lead with the methods when we're sharing our findings. We include those bits of information, but know that they just want to know the findings in most cases. So the next several slides outline some of our findings, but they're just high-level examples. And like I mentioned, there are detailed reports if you want to look into this a little bit more. On this slide, you can see a subset of our findings that showed the location of the LEND program training grants during the evaluation period. So the LEND program is the Leadership Education in Neurodevelopmental and Related Disabilities training program. So it's one of those 4 grant programs that I mentioned earlier. So now in the age of COVID, I think all of us are very familiar with looking at maps like this that show the density of a certain variable within each state. I think I look at those every day as it relates to COVID cases. But maps like this can be helpful for decision makers as well. So here you can see which states have the highest concentration of grant programs. And decision makers can easily look at this to see which regions of the country might be covered more by the grants and which ones less. And they might use information like this to direct funding towards certain areas in the future that might be underrepresented, or they might not. But that is one way you could use findings like this. On this slide, you can see a different type of finding. And this shows the impact that the program had on increasing the number of individual professionals who received training through the LEND program. So here you can see the total number of trainees that the program trained each year. And you can also see the trend across 2 time periods. Again, this is a pretty simple finding, and it might seem not as complex as some of you in academia might be used to with big tables of your results, but it did involve compiling data submitted by the 40 grantees that were part of this program and boiling it down to this easy to digest information that decision makers can use. And I see a comment that I think it's important to mention about the number of grants per region is to identify that density is a strong variable. For example, New York City equals 8 to 10 million people. Great point. So there are all sorts of other ways that we can present. I'm just going to go back to the map here. There are all sorts of other ways that we can present these findings in relation to population. We can present these findings in relation to which ones are medically underserved areas. We can present them in relation to actual autism incidence and prevalence in those different areas. So that's a really good point. And there are other ways that this information can be shared to give it more context so that decision makers have more information to interpret these results. Thanks for mentioning that. Now, as I mentioned earlier, one of the goals of the program was to increase awareness of autism and interventions among providers. Another type of finding that we provided throughout the report were examples of how grantees met these different goals. We conducted detailed qualitative coding of the grantees' progress reports and used that information to identify themes. So some of the common ways that grantees addressed this and were working to increase awareness are listed down the left, and specific examples from grantees are listed on the right. So for example, one way that grantees increased awareness was through developing and putting on grand rounds. And the example that we highlighted was from the Medical University of South Carolina, and they held rounds for pediatric providers and used telemedicine to reach rural providers. So again, this is just an example. There was a lot of behind the scenes research that went into this, thousands and thousands of pages of coding of qualitative self-reported information from the grantees. And we found common themes and then found specific examples to highlight those themes. One of the sub-goals of the program and of all activities at HRSA is to target underrepresented groups as a way to reduce disparities. As part of their annual reporting requirements, grantees provided information on the demographic characteristics of their trainees. So in the bullet on the left, you can see some of the different ways that grantees worked to increase diversity. And on the right, you can see some simple infographics that show that during our evaluation period, 1 in 5 long-term LEND trainees was a racial minority and 1 in 10 was Hispanic. So of course, there's much more to the story here, but decision makers can look at this as a quick snapshot if they're trying to match this against agency priorities and can potentially think about directing resources to make improvements if that's something that they deem is necessary. Or maybe they look at this and think that this looks really good and that they are meeting the agency's goals and priorities. One of the other objectives of the program was to contribute to research. So this graphic here outlines all of the studies that were conducted by the research grantees and categorized them by topic. Again, this is a simple way to show decision makers the areas of emphasis of the research funding. As you can see, some of the topics with the most studies included disparities in care, obesity, the transition to adulthood, and clinical practice variation. So a quick snapshot like this can help agency leadership determine whether the funding is targeting the agency's priorities. And potentially, information like this can be used to encourage research in certain areas over others, and to make sure that the funding is targeting research and filling research gaps. Okay. We also compiled some basic descriptors about the research that was conducted. Here you can see on this slide the number of children that were included in the studies, the number of studies that were completed, the percent of the studies that included underserved populations as participants, and the percent that included the needs of underserved populations as a focus. So again, here's a place where we really could have highlighted a lot of different figures. We had a lot of available information to us, but we really had to pare it down and focus on the agency's priority of targeting underserved populations and make sure that that information was easy to find. That's one of the biggest challenges, I think, of policy research and reporting on these results. Is it's really easy and sometimes easier to write a 100-page report than it is to write a 20-page report, and put ourselves in the shoes of the decision makers that have a million things on their plate and are looking for easy to digest information that answers their questions and helps them from having to dig through a gigantic report and not know where to find the information that they're looking for. So again, these were some of the findings that we pulled out here. To complement the earlier slides on the studies themselves, this slide highlights some of the dissemination products that the grantees produced, such as manuscripts, conference presentations, clinical guidelines, and tools. And these are the numbers that they produced during our evaluation period. The purpose of these findings is to highlight the reach of the program's research activities. So how much is the program working in a bubble versus how much are the funding that the government is putting into this reaching others working in the space or in other spaces, and measuring the dissemination output is one way to look at that. One of the challenges that we faced is that not all grantees generated quantitative data on their activities. In those cases, we had to rely on qualitative data, such as information that the grantees provided in their progress reports, which were written narratives, or in data that we collected through interviewing the grantees. So some of you who might be more quantitatively minded might have expected in this presentation to see a lot more numbers, a lot more percentages, and hard statistics. And there are instances and cases when those data are available to us as evaluators. But in this case, we had several grant programs where all we had were qualitative data. So to highlight those findings, there are many cases in our products where we pulled examples that were organized by theme. So for example, this slide shows some of the ways that state grantees worked to reduce disparities within their state. So that includes things like hiring bilingual family navigators, providing webinars to pediatricians that were serving low-income families, and improving access to care for individuals in medically underserved areas. So these are specific examples tied to states, and some of them were topics that several states were doing. Now, on this slide, you can see what I think are some of the most impactful findings that we can share. These are direct quotes from individuals involved in the program. And these were obtained through interviews with the grantees and show in their own words the impact of the funding. One grantee from the University of Pittsburgh LEND grant program said that they would be unable to sustain any type of interdisciplinary training related to developmental disabilities without this funding mechanism. And that person said that the funding was crucial to strengthening the pipeline of professionals. A grantee from the Medical University of South Carolina said that the Autism CARES funding increased the exposure of the program nationally, and that it allowed them to provide training that they would not have been able to do at all. So I'm a little bit biased in this area since my training and background is in qualitative research, but I think findings like this, especially when you couple them with some of the quantitative findings, can be really impactful with decision makers who are trying to decide on the fate of a program, and to really see in people's own words the impact that it's having on them, on their patients, on their providers. I think that goes a long way. Oh, I see a question coming in here. The program and project funding cloud is very informative. Given the increasing number of unfortunate events involving law enforcement violence against autistic people, to your knowledge, did any of your findings reveal programming on the engagement of autistic people with the criminal justice system and law enforcement? Yes, we have some specific examples of, oh, Anne. Yes. Did you want to chime in, Anne? Maybe I'm missing.
No, that was an error. I would love to hear your answer.
So we did see some examples. I can't remember off the top of my head which states or grantees were working on that, but we did hear about grantees using the funds from the Autism CARES Act to provide training for law enforcement officials and make sure that they were up to speed and were aware that they might encounter people with autism on their beat in their daily life. And that's the type of thing that is, we could write an entire report on that. And in our case, it is an example of one of the types of things that one or maybe a handful of grantees were doing with this funding. So that's one of the challenges that we face as evaluators and people trying to report on these results, is to decide what examples make it into our products and reports. So these products that are on the screen now are full detailed reports where you can learn a little bit more about examples like that. So thanks for mentioning that. Okay, I see another question that I'm going to address, and I just have 2 more slides here to wrap up. So as I mentioned on the slide here, you can see what our research products were. We had a final evaluation report that was very detailed. We had a report to Congress that we contributed like 2 paragraphs in this gigantic report, because the report to Congress covered all of those agencies, and we helped prepare the part about HRSA's effort. And we also compiled our findings into program-specific fact sheets. I can't remember exactly, I think maybe they were a couple of pages each that talked about the impact and efforts within each of those 4 grant programs. So those are all available on the Maternal and Child Health Bureau website. I have a link at the bottom of the screen here. To wrap up, and then I'll hop in and answer this question, I just had a couple of conclusions here. I hope this example of the Autism CARES Act evaluation highlights how policy research can impact our lives, both as professionals, as researchers, as clinical providers, as people living with autism and their families, as educators, but also really as citizens who touch these programs and policies in our everyday life. By providing decision makers with the information that they need to make informed decisions, we can ensure, or hope at least, that legislation is being crafted based on evidence and that programs are being designed and funded to provide support and resources using our taxpayer dollars in the most effective and efficient way. Again, this is the same graphic that I showed earlier. It's an ongoing process. This type of research is happening continually, and researchers like us are working on an ongoing basis to address policy issues and challenges and continue to evaluate new and existing programs. So I do encourage you all to consider the importance of this type of research as part of the larger funding mechanism. And for any of you that are working at institutions where you might get invited to participate in an evaluation, complete a survey, do an interview, I encourage you to do that. Hopefully you can see how important it is. So I'll open it up to questions here, and I see one that has popped in, unless Anne, if you wanted to say anything first.
No, go ahead. I think Chris has had a couple questions about how self-advocates have been involved, how their voices have been represented both in your evaluation and in dissemination of your findings.
Really great question. And it is something that I think is changing on a daily basis. We literally just on Monday had a full meeting among the health team at Insight Policy Research to talk about how to better involve stakeholders in an inclusive way in our research. And sometimes we have to follow what is in our contract. And it might be very specific. You will do 6 focus groups and you will talk to these 3 people and then you will tell us what you found. And other times when we have more flexibility, we do our very, very best to bring in the diverse voices of all of the different stakeholders. In this particular study, we did not include people with autism in our design or data collection unless they were grantees and kind of were wearing multiple hats. But lots of the grantees talked about work that was happening with self-advocates and the work that they were doing to involve them on a daily basis on the ground in the design of their specific programs and their specific institutions and how to incorporate their needs and experiences and values. So it is an ongoing conversation that we're having, and luckily a new focus has been placed on including self-advocates and direct stakeholders in the whole research process. So not just as interviewees or as people to complete a survey, but in terms of helping to design the research and helping to disseminate the findings as well.
Yeah, and it seems like one of the most important roles people can play is to help move things forward as we go, to be a voice about recommendations and policy actions, to speak up. I was thinking about yesterday, unfortunately, the call for public comments closed for the Interagency Autism Coordinating Committee on the research plan, but there are opportunities like that come up periodically. And I think staying apprised of findings like yours are helpful in helping people know when and what to speak up about. So thank you.
It's hard. It's a big world out there. It's a small world, but it's a big world. And sometimes this information doesn't get publicized the way we would want, and it might be buried on a government website 18 clicks in, and it's hard sometimes to know what's going on. So we can all help each other with that.
Absolutely, absolutely. And I would encourage everyone, if you have additional questions, we'll continue to monitor the box. And I do have one follow-up question though, Rachel, and that is, can you tell us a little bit more about what happens next? What are the next steps with this evaluation?
So that's a really good question and is a tricky one to answer. So Insight Policy Research, we were involved in this evaluation for about 10 years. We had 3 separate contracts. Each one was 3 years long. And that was when Insight was a very small agency, and we had a different classification in terms of what type of group we were. And the contract for the evaluation was specifically to go to a small kind of startup type of agency. So Insight Policy Research has graduated out of that group, and we were therefore not eligible to continue to work on the evaluation. And it is, as far as I know, continuing and got awarded to another type of startup size research organization. I have been monitoring the website, the Maternal and Child Health Bureau website, and haven't seen a lot of updated findings, but that doesn't mean that research is not happening. As I'm sure you can all imagine, reports take a long time to make it through the federal government clearance process. And as far as we know, the evaluation is still going on, and there might just be a delay in the findings.
Well, that's fantastic to hear that it is still going on, that someone is still evaluating it. And you had mentioned earlier about how evaluations like this can inform reauthorization of legislation like the Autism CARES Act. Can you share a little bit more about how that happens?
So on this specific study, obviously we're not in the room where it happens, like in Hamilton. We're not there when those conversations are going on. All we know is we delivered this report, it provided this information, and then we can see the legislation that comes out. So some of the types of things that we've seen specifically related to the Autism CARES Act, like I mentioned earlier, is an increased focus on the full lifespan, focusing on that transition to adulthood. We have seen some changes in the number of grantees that have been funded and the emphasis and focus. We have seen over the 10 years that we were involved, some new grant programs kind of evolve, and the mission of some of the programs evolve as well. So the mechanism, how that works, is the funding gets authorized, it gets funneled to an agency like HRSA and then the Maternal and Child Health Bureau. And then what they do is they put out their funding opportunity announcements or their grant announcements. And those are kind of like contracts and legal documents. So if you get awarded these funds, you have to do these 5 things, you need to report on these 10 things, and you need to meet these deadlines. So that's kind of the mechanism where the rubber meets the road, where the funding gets allocated and then it works its way into the grant opportunities that people then respond to.
Okay, thank you.
And I see a question here. What are your thoughts on the impact of these many grants and programs that you evaluate? Do you feel like they are making an impact? Yes, that's my personal opinion, but that's one of the benefits of doing this work, and particularly mixed methods research, where we're not just looking at numbers and where we're actually talking to people. I love that part of my job, and I love getting to talk to grantees. A lot of the other work that we do is with, we get to do interviews with patients, we get to do interviews in focus groups. I was just on a focus group earlier this morning with food stamp or SNAP beneficiaries for another evaluation that we're working on. And those are real people living their lives, and they have taken time out of their day to tell us about a program that we're trying to understand better. So I am privileged to get to hear those experiences and stories from people, and then get to share that with people that are making decisions. One example that I was telling Anne and Caitlin and Kyle about earlier, another project that I've been involved with for about 10 years is with the Department of Defense and relates to women in the military. And for that project, we have conducted hundreds of focus groups with men and women in the military about all sorts of issues. And one of the issues that we learned a lot about, particularly in 2015, was online sexual harassment. So our research resulted in a recommendation that went to the Secretary of Defense about changing the definition, the legal Department of Defense definition of sexual harassment to include online harassment. What that resulted in was literally a one-word addition to the definition in a gigantic policy, but that had a real impact on people who had experienced that. There were now, legal implications and ramifications by literally changing one word. After doing 60 focus groups and talking to thousands of people, it resulted in a one-word change, but I think things like that can make a big difference. That
is such a great example. And your talk made me curious about whether other pieces, is every major piece of legislation like the Autism CARES Act evaluated, or only some evaluated? How does that happen?
Unfortunately, not everything is evaluated. If I think we all had our way, and my colleagues, we would make sure that anything that is using taxpayer dollars was evaluated. But of course, that is expensive and consumes resources as well. So not everything is evaluated. One example, we were just involved in another evaluation at the Maternal and Child Health Bureau in HRSA about the Emergency Medical Services for Children program. And that program had existed for 35 years and had never been formally evaluated. Similar size actually to the Autism CARES Act in terms of the number of grantees, and it had 6 different programs, been around for 35 years, and for lots of different reasons, an evaluation was never funded. So we had to come in and design an evaluation for a program that had been running for 35 years and figure out how, there's no baseline. We don't have, it's not like we had 0 program and then it started and we could look at the impact. It had been going on for decades, and we had to figure out how to determine the effectiveness. So those are some of the real challenges that we face.
So I see another question here about what are your thoughts on the balance between collecting data to inform evaluation and the strain that this may have on already limited staff at many programs? That's capacity to do this type of work is such an important question.
I am so glad you asked that. And it's something that we are cognizant of and struggle with on a daily basis as researchers, where we're basically relying on people to most of the time volunteer their time to help us with the project that we're working on. And we try to be transparent and also creative with the incentives that we can provide to people for participating in that type of research. So sure, I can help you, but what's in it for me? And when we're dealing with sometimes patients, or when we're dealing with beneficiaries of a specific program, we might be able, and we're doing a focus group, let's say, we might be able to compensate them maybe with, a $40 Amazon gift card or something like that. But when we're dealing with professionals and we're asking them to take time and share their professional opinions in their very busy workday where they're juggling everything under the sun, that's really hard. And one of the things that makes it easier for us as researchers is if participation in evaluation activities is mandated as part of the grant funding. So we are going to pay you, this grant is for $50,000 and you're required to do these 3 things. Oh, but also you're required once a year to complete a survey and spend an hour on the phone with the evaluator. And making that mandatory helps us a lot because the grantees know that that's part of their responsibilities to being a grantee. Doesn't always work like that. And in those cases, we just try to be really nice and be really flexible with our scheduling and give people lots of lead time and talk to people at whatever time of day works for them, and hope for the best. But that's a big challenge and one that we recognize.
It is, and it's a parallel challenge, I think, to dissemination efforts, that when dissemination is a required component of a grant and when there's funding provided for it, it certainly makes it obviously a lot easier to try to pull it off, because that is, you know, as you talked about, a very specific set of skills to try to find a way to communicate that to people in a way that is actually usable and makes a difference. So one of the things that we are trying to do at the Policy Impact Project is first to focus on translation of research into policy and getting the information into the hands of people who need it. But also we'd like to help researchers be more aware of policy and how they can connect their research questions to existing policy. So since you're in the weeds on this all the time, I wondered if you or your team have certain ways that you use to stay informed about policy and connected.
That is definitely an in the weeds question. And I'm glad you asked it, because there's not a silver bullet answer to that. We do things like read legislation, like we read the defense spending bill, that's thousands of pages, and we search for things like sentences that talk about new research that they're trying to fund. And we read, you know, the new infrastructure bill and think, oh, maybe there's something in there related to autism. It might not intuitively think that infrastructure relates back, but maybe there's something in there. So let me search for it. Let me comb through these gigantic pieces of legislation, because those are the places where government funding trickles down. So it might be one sentence where it says, you know, part of this funding is for the Department of Health and Human Services to develop a new program in 3 states to get people on the spectrum working on some of these, I'm making this up, working on some of these infrastructure projects. And we would look at something like this and say, oh, that's really cool. I wonder if they need to evaluate it. And I wonder if the agency that's administering that is going to have some funds set aside to assess that. Or groups like you all who are on the line might look at something like that and say, oh, we should keep our eyes peeled for that. That we do things like that. That could be something that we could be involved in. So it's not fast or easy. And it involves kind of paying attention to big pieces or small pieces of legislation. And this could be at the federal or at the state level. And kind of combing through and doing some targeted searches, setting up some alerts just on following the news, and then back to the primary document and kind of combing through. So there's not a fast answer to that.
No, and it's hopefully something that a program like ours with some dedicated time can help deliver that type of information to people. We are at 1 minute. And so I think there's so many more questions that I have and that we could answer for you today, but I just want to thank you for your time. You know, in our work, we do a lot of filling out forms for our grants, and it's so exciting to see what happens with that information, where it goes to. And it's been just really insightful to hear the overview of all of these different efforts that are going on to help improve the lives of people with autism. And we thank you for your role in that and for sharing all your expertise with us today. So you can continue to follow Rachel's work at Impact Policy, and you can follow us on Twitter. And we hope that you all will join us for our next Policy Power Lunch to be announced soon. So thank you for your time today, everyone. And to you, Rachel.
Thank you.